As this is a long video, I strongly recommend saving it, watching it multiple times and using the timestamps to navigate quickly from one chapter to another. Do you want to master the deep tissue massage technique that effectively releases stubborn muscle tension and restores natural mobility? In this video, I'll guide you through expert steps developed over years of clinical experience. Stay with me until the end to discover key insider tips that ensure the best lasting results whether you're a beginner or a seasoned therapist. This comprehensive tutorial will provide you with practical, proven massage techniques. Very well, so we will start right away with the massage of the cervical area together with the shoulders. So how do we begin to assess and understand how to apply this type of massage? The first fundamental thing is to put the patient in a condition of absolute relaxation. So find the appropriate position for a perfect treatment. In this case, we make the patient lie face down and preferably with a hole for the face so that they do not have to turn to the right or to the left. And the first touch obviously is an initial exploration. Applying cream or oil to the area, we start in a very soft and light way to massage the patient. What techniques do we use in this phase? And kneading can also be useful. So kneading massage is a massage technique that is used to relieve muscle tension and improve blood circulation in the body. So yes, kneading is decisive in this case to try to decontract the area. But the first approach is with a light stroke because we must warm the area a little. So this stroke or sliding tries to irrigate the area, and when we reach an appropriate temperature, when we feel that the area starts to warm up, we can act in a slightly more decided way, working both the cervical tract and the trapezius area more firmly. Very well, then we start with a stroke and we evaluate according to the temperature we perceive with our hands. We evaluate if we start applying a kneading or continue with the stroke. What we are seeing now is precisely that work which allows us to evaluate and travel all the muscular tracts, trying to understand and find if there are areas of particular rigidity or tension. So the technique is this. A start of kneading, we move from stroke to kneading. So when we have a good perception of heat and the area has reached an appropriate temperature, we can work the musculature in a more intense way based on the indications of the patient about where they feel more discomfort and on the sensitivity of our hands, of course. Thus, we go looking for these contracture points. As you see, we stop when we feel a muscular density. Yes, because when we feel a greater stiffness or resistance by the muscle, we stop and work the area a little more to decontract it. The images are very clear here, so it is about searching and finding those resistances, those muscular densities more marked. There are several situations, of course, that may present themselves in the muscle. Our skill must be to identify the areas of greatest distress. The hand gives us this opportunity because when we travel and feel areas with greater resistance or when the patient becomes tense when passing there, we must focus our work on that area, trying to reduce that tension as much as possible, avoiding generating pain in the patient, of course. So, we can alternate between stroke and kneading. We can start with a stroke, then a kneading, and if necessary, return to stroke during the process. Yes, we can alternate the different techniques without problem, even take pauses between them. We do kneading work where the muscle is worked in a more intense way for a few minutes, and then we can return to stroke to relax the patient again. We have moved on to treat the shoulder area with that deep tissue massage technique. There is something specific I want to say about this part, which we have included together with the cervical area. There is a relationship in these tensions that can begin in the cervical tract and extend to the shoulders. When we help a patient resolve their problem, we try to broaden the range of action and application a little. We focus on the affected area, as in this case the cervical tract, but we also work on closed areas, though for a more limited time. This provides great benefit because the relief perceived by the patient is much greater. Yes, indeed, the trapezius has a very active role in neck mobility. And in this step, what am I doing? As you see, we move laterally to the spine. It is about looking for areas of tension or small contractures in the paraspinal muscles, because they often are a consequence of cervical stiffness. To do broader work, we explore all the muscle groups involved in the movement, dedicating a few minutes to these rigid areas. Good. And now, as you see, we do a detachment technique, asking the patient to place their hand on their low back, lifting a little bit the scapula gently. Being an area that rarely suffers invasive trauma, we try to open up subscapular areas of tension that the patient may not be aware they have, but which we must explore to improve shoulder mobility. These stiffnesses interfere with the cervical area. Thus, reducing cervical tension with this treatment is very beneficial. Now we move to the lumbar and dorsal area. We always talk about deep tissue massage, but in the dorsal and lumbar spine, we start first in the lumbar area and then in the dorsal region. So what are we doing now? As we can notice in the images, the approach in the lumbar area must be particularly soft because it is an area that suffers a lot. Many people have problems of stiffness, tension, or pain in the lumbar area. So, to put the patient at ease, we start with a very soft technique, just like in the cervical area, to warm up the zone. Working more intensely in the lumbar area allows a greater range of movements due to its particular physiological structure. This is a kind of stroke that we are seeing now, a stroke covering both the lumbar and dorsal area. We try to warm the whole area doing small mobilizations to see how much resistance there is, right and left. We first work on the surface and then go deeper. We must always work on the paraspinal muscles, like in the cervical zone, looking for tension areas because ignoring that can limit the result of our work. We do lateral movements and use the thumbs to press on the lumbar square where tensions are greater. This way we manage to work more harmoniously so that kneading becomes faster and more effective. The lumbar square we can access more easily so we can create a deep finger pressure. This detachment we are seeing is very pleasant. It is done on the sides of the spine, the paraspinal muscles, with one hand pushing down and the other lifting the skin. And what do we do now? We push up and down, not always up. The other hand only holds the skin. The predominant pushing hand is always the one going upwards. Then we can do the kneading work. We do it after the separation and also after having done with the forearm a relaxation work, as we will see, and the pressure of the other hand on top, so we can really superimpose and reach the appropriate depth. Obviously, to reach that intensity, we must have done all the previous steps, because if we start with the aggressiveness like what we are seeing now, surely the patient will not accept it willingly. So it is very important to follow the whole process to be able to act in that way. Generally, when working a bit on the spine, always start from below, that is from the lumbar area, then dorsal and cervical area. This is because upward pressure facilitates venous return and lymphatic drainage. It's an additional advantage and the work becomes more harmonious. So it is better to start from the lumbar zone, then the dorsal, and then the cervical area. Even the person receiving the treatment has a different sensation because it feels much more fluid and complete, and could almost actually help in treating the lumbar area to already reduce tensions in the dorsal area. Once the lumbar area is treated, you almost realize that effectively the dorsal area has loaded a bit. Well, above all, among the various muscle groups, there is a relationship, an important link. So whatever we treat, that the close muscle group benefits. If then we work all three, obviously the benefit is global. But if we reduce lumbar tension, surely the dorsal area will reflect the benefit. This technique we have seen with the elbows, what is it about? This serves to try to react with a much wider surface. Now that we have a warm back predisposed to any type of impact, with both forearms, we manage to cover a very wide surface and work very completely. Now we have moved downward, but in the dorsal area it is more useful. Yes, because the dorsal area is very wide, but also very tense. Sometimes the hand can have a difficulty reaching that kind of target, but for that, helping oneself with a forearm with a larger surface is of great utility. To summarize, we start with a stroke to evaluate and notice the biggest tensions on the right or left. Then we thermally prepare the area before going deeper with the hand. We investigate and warm. Then we use finger pressure to reduce tension in a specific point, doing cutaneous detachments to improve the lymphatic and subcutaneous circulatory flow. And we can use the forearm and the elbow to deepen the work. So that technique in the dorsal area that looks like I'm rubbing, what is it about? Well, this is one of the many vertebral techniques, and it serves to try to soften the area. This is a specific work in the paravertebrals because it works in the lumbar, dorsal, and cervical area. As you see, we are also using the fist in this case. Those are all the technical variants that our hand offers us as opportunity and possibility. That magical tool gives us the possibility. We must try to use them all because each of these techniques gives us a message. So anything that we adopt with the patient, we receive a signal, a feedback. Now look at the reddening, look at the hyperemia, the blood that flows with this technique. Apparently, it may seem something aggressive that the patient might complain about, but in reality, it is so warm and relaxed that they only perceive pleasure and relief. How are we going to conclude the massage? Is there any special consideration to do the deep tissue massage between those two zones? Having worked those two zones, actually three, because the cervical area is always worked even partially, when concluding a deep tissue treatment of this type, we must go over the whole area until reaching the nape, as we are seeing now. Because we must be certain and guarantee having worked the entire area. Surely the result has been achieved because, as you see, the patient is completely relaxed. The cutaneous hyperemia that we are seeing now shows us a global work. The last inspection before concluding that is doing lumbar, dorsal and cervical is a guarantee for us and a guarantee for our assisted person. The gluteus is a muscle sometimes little considered, but in athletes it has great importance because it is a muscle that tends to fatigue and contract, and very often the athlete does not have this sensation. Therefore, as usual, to try to help globally, we do an inspection of the gluteus, as we are seeing now, trying to understand if there are tensions. Then it is not certain that there are, but we search for them in two ways. Let's say you treat the gluteus and the piriformis almost together. Now we are seeing some combined mobilizations, but we also use as a test to evaluate the density, that is muscle tension. When we work the gluteus, we start with a light touch, but let's say it is an area that if we do not warm it well, we cannot work it well either. So we do the kneading work. We try to understand how willing the muscle is for the massage and how much resistance it imposes on us. If the muscle on the surface is relaxed, we can work it very calmly and go a little deeper. We have already used the elbow, and in this case, this is a somewhat more invasive technique. Yes, because the piriformis is a very deep muscle, sometimes only with the hand and finger pressure. It is a little more complicated to treat it. The elbow, which apparently seems something very aggressive, but we are the ones who modulate the pressure intensity ourselves. So let's do a bit of intra and extra articular work, applying also circular movements here. So you can combine finger pressure with circular movements and also a slightly stronger compression with the elbow. Let's say the options we have are many. The circular work, the kneading work, the classic massage work is always well received and always useful and works very well when we have to go a little deeper. Therefore, working on the piriformis, we help ourselves with the elbow, where we handle and modulate the pressure ourselves. It is not necessarily a very strong or very light pressure. It varies according to the response we receive from the patient. So we almost always associate it with the glutes work. A little mobility work of the hip, therefore of internal and external rotation. Look, have you seen this technique before? This is a kind of squeezing of the muscle, being the gluteus a particular muscle also in its anatomical conformation. In this way we can eliminate a bit of tightness. I must say it has a very pleasant sensation both for the one doing it and the one receiving it, because you feel the difference after applying it. You feel the difference, you feel the muscle decontracting, you really feel the muscle relaxing. Well, and how is it done? You close both hands and you pull, almost detaching the muscle upwards, but in reality you do not detach it. You do it like a press with the palms of both hands and compress it. This compression, this squeezing greatly relaxes the area. You can use the fist with those circular movements we are seeing now. You can combine all those techniques that you're seeing. What precautions, what suggestions, what secrets an expert in the field give us. Look, the real secret here is to listen to the muscle. Therefore, we use our hands to have a perception of what we are doing and how we are working. These techniques you see are made precisely because, as we have said, the hands offer you an immense range of works. They are all techniques one can refine to get a response as to how the work has been. In this way, for example, I can understand how much I have managed to relax the muscle, because with the fist I can go deeper without generating a negative reaction from our athlete or our patient. That's how I realize how much I have managed to complete my work. Also, in this case, how do we conclude this massage combining these techniques that we are seeing? Well, we always do a final review, let's say, at last inspection, to see if between right and left there is an area that can still have a small problem, or if instead you have the perception that it is identical between right and left. You can conclude calmly like that. So we seek the harmony of muscular density and conclude the massage like that. Now we will see the deep tissue massage of the iliopsoas muscle, an important muscle of the pelvis, the main flexor of the hip. How do we approach the massage? So the iliopsoas is a muscle, as we said, very important, but also very strong muscle, and tendentially a muscle that almost always is sore. Therefore, every time we search for it, we find a level of pain on the part of the patient. we're treating. As you can see, we always try to warm the area well, prepare it, soften all the superficial tissue to not have any form of resistance or opposition so that we can act in a decisive and deep way. So, look, this is something that with the years one perceives and improves. Putting much oil or a lot of cream creates a very fluid and very fast movement, but limits the perception of the hand, therefore extremely reduces sensitivity. Putting too much oil or cream acts as a barrier to the real sensations that we must absolutely have about our patient. Therefore, I advise you to put this strictly necessary amount so as not to irritate the patient's skin, and is strictly necessary to maintain appropriate perception. Now, as you see, we are almost anchoring to the iliac part of the psoas, and we are applying this compression. Actually, it's not exactly any ischemic compression, but it is an important compression for sure. Here we are evaluating the psoas muscle, how sore it is. The first impact, therefore, it is the first palpation to understand how far I can go and how much there is to soften. Sometimes we find incredible stiffness situations and sometimes softer, depending on what we perceive. So we must work more effectively, and to be able to work without generating too much discomfort, we must work in hip flexion, therefore lifting the leg. The muscle inevitably relaxes. It allows us to work a bit deeper. In practice, we lift it ourselves. Obviously, we do not make the patient lift it because the patient must be in complete rest, therefore must not generate the slightest tension. So everything starts from us. But this technique may be a little painful for our patient. So let's say that once we understand how much we must act and begin the real psoas treatment, inevitably, in this case, we must generate a bit of discomfort because it is a sensitive muscle and because it is a muscle that is not very used to this type of treatment, unlike other muscle groups. Therefore, we must do it very carefully and very calmly, not be particularly aggressive, arrive gradually. As you see, the prevailing technique is the compression, almost an ischemic compression, as we said. We have the knee flexed and relaxed like this to be able to palpate the psoas better. And yet, as you see in this case, we do not have many combined techniques compared to the other muscles. In this case, it is a muscle that does not allow us to do kneading or stroke. It will have no efficacy here. Therefore, the only way we can work is with the finger pressure or small lateral movements, always alternated. The finger pressure we apply lasts a few seconds and then we release. Therefore, it must be a fairly long work, but with many pauses. The only stroke we have seen here is the initial abdominal stroke to warm up. Obviously, to go to the specific, it is impossible to do kneading or stroke, but this compression technique is used and especially circular. It is not a real ischemic compression, we said it. It is more of an alternating rigid finger pressure with movements, also a bit circular, yes. Also, it is a very well localized technique, unlike other muscle groups where we can move freely. Here we must work only on that specific muscle. Therefore, once we find the dense muscular part, we anchor it well and must absolutely work there. Also, in this case, we work bilaterally. As we have already said, sometimes the patient may refer a suffering area on the right or left, but the other part can be equal or in many cases even more serious without knowing. But it is our job to check it. So, as we have learned, the massage ends and we advise to always end it with a kind of overall initial caress summary, as you are seeing in the abdominal part. Let's say, to be sure to leave the patient in a relaxed condition, almost to make him forget a little the discomfort he may have had. And with a massage that is very light, soft, to eliminate the small pains we have previously generated. Now we will see the deep tissue massage of the medial gastrocnemius, the lateral gastrocnemius, but also of the soleus. Look, the deep tissue massage is a sectorial massage, which means that the patient points to us a muscle group that feels particularly tired, particularly intoxicated in quotes. After an effort, an activity, a training, we are going to work exclusively on that muscle group. In this case, we examine the calf. Let's say that the first approach is very soft, because obviously we do not know how sore the patient is and at which point. Therefore, we begin in a very light way with a caress. And as soon as the area begins to warm up a little bit, as we always say, preparing for something a little more important, let's say, we begin to work the various muscle groups. We always start from the bottom, so the pressure is always towards the heart as a good norm that has been taught to us. That obviously facilitates venous return, facilitates all lymphatic movement. Starting from the soleus, we moved upwards, almost with a sort of clamp-type grip. It is not exactly a clamp, but we look to work a bit on the anatomical design of the musculature here. So, therefore, we go through with the fingers, trying to understand if there is some area that may be more distressed than others, a bit more contracted, let's say. And we also combine a kneading. When you knead and run through the muscle, there are areas you can knead in a much softer way and others that are more difficult to work. That is normal. That is already a symptom that the area is in a little crisis. Once we have evaluated the whole muscle, we start this deep tissue massage work. It is a job that more or less takes about 20-25 minutes. What are we seeing now? What is this technique in practice? As you see, we're pushing now. It is a very simple manipulation work, a basic manipulation work. In this case, we work with the whole palm of the hand and try to involve the whole muscle in the exact pressure, homogeneous pressure of moderate intensity. Therefore, we must not bother the patient, we must relax them. And when we have worked globally, we can identify the areas to work a little more in. This is kneading and helps us try to relax the area as well. How long does a massage of this type last approximately, or should last? Normally, when we do a deep tissue massage, because the person receiving the treatment feels at that point a real discomfort, so it lasts from 20 to 25 minutes. Therefore, having a shorter treatment could be insufficient. Then, of course, it is not that the duration guarantees the result, but surely, if the time is very limited, it is more difficult that the result is positive. There is a time limit after which we have a response, and instead, if we do not even reach it, in practice, the muscle almost does not feel the massage. Let's say that doing a treatment of less than 15 minutes, for example, might be too limited to do a good job. And this is because treating all muscle groups, always looking for a solution for all and trying to achieve balance between the muscle groups takes time. So that is why I tell you that 20-25 minutes is a full time to have a good result. Now, as you see, we flexed the knee almost at a 90-degree angle and are flexing and stretching the foot while still massaging the calf, associating a little bit of muscle stretching to see if there are areas that resist a little more, that have difficulty stretching, or if there is really a wide mobility. So the calf in this case manages to stretch without difficulty. If we find points in which we feel that the patient resists, then we will return to work obviously with the kneading and the techniques we know to reduce the tension even more. Another important muscle group that is often referred to by footballers, but in general by many athletes, is the hamstrings. So how do we approach the deep tissue massage for the hamstrings? Well, the methodology obviously is very similar to the one we have already explained. There is always an inspection phase, an evaluation. Let's say the first evaluation is the one that the patient tells us, giving us signals, saying that perhaps there is an area with more or less muscle tension where they can feel discomfort. In reality, we can take it into account, but it must be our hand that really searches where we must work. Therefore, we warm well the area, we work it a little in all its entirety. We prepare it for manual activity, and then, as we have already done before, we start inspecting the entire path of the muscle groups until we can find obviously areas of rigidity which may also coincide with what the patient has pointed out to us, but sometimes may not coincide. Therefore, in addition to what the patient presents to us, we find other areas in which we must act, where we must do something. Also, this muscle group requires a little bit of work, approximately 20-25 minutes to have a good result. Let's say we trust what our mind has told us. Of course, not too much. We should trust more the palpation of our hands for sure. Well, let's say that our work, our best friend is the hand. It is the vehicle, the key point on which we must base our work. Surely, having signals and manifestation can help us, can be a guide, but the answer or the identity that the hand finds at the moment it makes contact is the most important. So, for example, in that image, you see that in those circular movements with the fingertips, the internal part is certainly a little more contracted, and which gives us a bit more resistance. And in that case, it is better to work more in it. Let's say that to understand if there is tension, to understand there is an area where we must really work, we cannot base ourselves only on the classic movement from bottom to top. Therefore, in addition to that, we must do small pressures, small pulsations, circular movements. We must create all those suitable situations to try to understand if there is a muscle that has difficulty. Very often with the circular movement, we can find them because maybe running linearly, the muscles seem all in order. In reality, with lateral transverse movements like this, in any case, always very soft with moderate pressure, we manage to detect slightly more painful areas. How do we approach the deep tissue massage of the quadriceps? A very large thigh muscle, important because it is involved practically in almost all sports. Let's say this is the dominant work in the sense that the muscle that has a greater need is the quadriceps, precisely because it performs enormous work and consequently is the one that tends to fatigue most often. Basically, the work is the same as for other muscle groups. It is a muscle that must be listened to a bit more in the sense that having many muscles involved in the movement, it must be inspected very carefully. An exhaustive work must be done both regarding the central part, which maybe is a bit more voluminous part, and regarding the abductors or the external part, because there is a tendency to neglect the lateral parts. In reality, those are very, very important. Therefore, doing a deep tissue massage of the quadriceps and doing it correctly and completely can need around half an hour work. In this case, we speak of both quadriceps, of course. So half an hour work of the right quadriceps and half an hour work for the left quadriceps. In this case, we speak of deep tissue massage. Therefore, we speak of a sectorial work, as we said, not bilateral. So working on a muscle, we dedicate ourselves to that muscle group and work only on it. If the signalization was for both, it would be less problematic because it would be a somewhat more general fatigue. But it is only in one muscle, so we must dedicate a bit more time. To recap, always work bilaterally. On the other hand, for the lower limbs, we advise you to work only on the part that our assisted person refers to us. If we work specifically, the deep tissue massage implies working on the muscle group that our assisted person pointed out and that has the need. Then we must be skilled to listen to the muscle because it is the one that calls us. It is the one that gives us the signals. It is the one that invites us to be treated. And that is the invitation we can perceive exclusively with our hands. Now you are seeing this kneading technique. We already know. And obviously, we have also seen it combined with a slight initial caress and light compressions on the rectus femoris in this case, as we are seeing, but you can use them practically on all muscle groups. Before you go, be sure to check out our trigger point techniques playlist. Just click the thumbnail right now to dive deep into specific muscle therapy techniques. If you enjoyed this video, please give us a thumbs up, share it with friends, and subscribe for weekly professional content. If you're a therapist looking for more technique tips, check out our full course at the link in the description. See you in the next video.